We're not saying that you don't have a cancer. We're saying that you have a cancer. It is slow growing, and we're betting that we can intervene when the cancer changes, whether that's at 10 years or 15 years or 2 years.
Because tumor is heterogeneous, so we don't know when it will biologically progress in some of the people. So cancer may remain dormant for a few years, and then something will happen in the genetic texture that it might progress to very aggressive cancers. And treating the aggressive cancer is very difficult at some point of stage, so it's better to monitor the patient lifelong rather than waiting for cancer to progress at some point of stage.
If you take out the whole prostate or you radiate the whole prostate, there are 2 side effects that men will have that are specific to the treatment. One is men can get urinary incontinence, and the second is there could be a change in your ability to have erections and in your sexual function. And the reason that you are not treating everybody with cancer is because you want to eliminate the side effects of treatment. You don't have these side effects if you're on active surveillance.
Usually they find really important things that help you in your day-to-day life. I would say increased energy. I would say definitely helping mood. Some people, we do also obviously talk about sexual health is a very important part. So those things I think can benefit for sure. And then objective things, weight loss, more muscle mass, leaner build, all of those things as well.
If someone's PSA is progressing, if someone has an aggressive tumor on the MRI, and if someone has an aggressive tumor on the biopsy. So those are some potential forms of aggression, and that we do it at intervals, like at regular intervals. We follow patients with the PSA, we follow up with patients on MRI every year, and once a year or like 3 times, like once every 3 years, we do a biopsy, and we try to find out if the patients are progressing on active surveillance or not.
So some of the tests we do besides the obvious like your height and weight and your body habitus, we do blood tests. So besides the PSA blood test, we monitor for blood sugar, something called hemoglobin A1C, which is blood sugar level in your body. We like to look at your cholesterol panel and make sure that that's not elevated. We look at things like inflammatory markers, like something called C-reactive protein that you might have heard about. We also even monitor for vitamin D levels. So we like to look at those things, and then testosterone, which is the male hormone. It's also in females, but we measure that as well.